Treatment for breast cancer has advanced dramatically in recent years as researchers and oncologists have made significant strides in understanding the disease and how to best treat it, including the awareness that not all breast cancers are the same and therefore require different approaches and medications. This has improved outcomes and greatly increased life expectancy for patients. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. We're focusing this month on breast cancer awareness. This week, we're talking about the latest new treatments for breast cancer and some exciting new developments on the horizon. I'm here today with Dr. Timothy Pluard, Medical Director of St. Luke's Cancer Institute and St. Luke's Kuntz Center for Advanced Breast Cancer. Thank you so much for joining us.
My pleasure.
So, Dr. Pluard, looking back over the past 12 to 18 months, there have been several exciting developments in the treatment of breast cancer. Can you tell me about what some of these are and why it's so exciting?
It's been a very exciting time over the last 24 months, despite the pandemic. So I'd highlight three important points. One is that we've seen the approval of 4 new drugs for breast cancer, which is a pace that we've never seen new drugs come to market. The second is we have seen an advancement in immunotherapy in breast cancer, both in newly diagnosed triple-negative breast cancer as well as advanced triple-negative breast cancer. And finally, we've refined risk in newly diagnosed breast cancer patients using genomic profiling. And so we can now identify about 40% of postmenopausal women who can be spared chemotherapy in their treatment. Wow. And achieve the same outcome.
That's huge. So that first point you mentioned, there have been 4 new approved drugs for breast cancer. Can you briefly explain what those drugs are and why they're significant?
Sure. So in triple-negative breast cancer, we have the first drug approved specifically for triple-negative breast cancer, sacituzumab govitecan. It is a very effective drug for triple-negative breast cancer and has improved the outcome for that population of patients very significantly. In HER2-positive breast cancer, we've had 2 new drugs. One is probably the most active drug that we've ever seen in HER2-positive disease, targeting the HER2 protein. The second is actually an oral drug that targets the HER2 protein inside the cell. But its major advancement is that it is effective in the brain. And we know that about half of patients with advanced HER2-positive disease will develop metastasis to the brain. So this is the first drug that has been shown to be effective in the brain, as effective in the brain as it is in the rest of the body. So that's a major breakthrough for them.
Fantastic. St. Luke's has been at the forefront of utilizing precision oncology and genomics to create specialized treatment plans to attack each unique patient's cancer. Can you explain how precision oncology and genomics are helping specifically with treatment options for breast cancer and how this benefits patients?
So at St. Luke's, we're fortunate to have the Center for Precision Oncology, which is really a leader in identifying specific mutations in an individual cancer that allows us to select drugs that target that specific mutation. So in breast cancer, we know that there are multiple mutations that we now have drugs that can target. So in 40% of women with hormone receptor positive breast cancer, they have a mutation in a specific protein called PI3 kinase, which we now have a drug, alpelisib, which specifically blocks that mutation. We also know that in the hormone receptor positive population, that when we're treating them with anti-estrogen drugs, they actually develop a mutation in the estrogen receptor. We now can identify that mutation in DNA circulating in the blood. So by a simple blood test, we can find the mutation. And that allows us to potentially shift to drugs that may be more active against that mutation. And we have a number of those in clinical trials right now.
So you talked a little bit about mutations. Can you explain more about how those play a role in breast cancer and what researchers have recently discovered that may ultimately impact how to treat patients?
So the mutations in the DNA are at the root cause of all cancers. And so understanding in a given individual what mutations have occurred in that cancer helps us to refine our treatments with drugs, hopefully, that can specifically target that mutation.
So it has to excite you as an oncologist to see some of these recent advancements, to be able to bring these new medications and research to your treatment plan for your patients. As you look to the future, what's on the horizon that makes you optimistic or hopeful as far as the treatment for breast cancer?
So a couple of these new drugs that we just talked about are a new strategy called AntibodyDrug Conjugates. So it's combining the targeting with the delivery of a potent chemotherapy payload specifically to the cancer cells and avoiding the normal cells in the body. So the biggest barrier to chemotherapy is the effect it has on normal cells and the side effects that come with it. So this strategy can improve the delivery of the chemotherapy to the cancer while sparing the normal cells. I think the second exciting advancement on the horizon is really our better understanding of the immune system. Immunotherapy in breast cancer has had a very small impact in the triple negative population only, and trying to understand the immune system better so that we can utilize immunotherapy across all breast cancers is going to be critically important.
Fantastic. So what can you tell me about a potential breast cancer vaccine in the future?
Well, there's a lot of work ongoing about breast cancer vaccines. The most common situation in which vaccines are being tested right now is in early stage breast cancer patients who have undergone standard treatment but remain at risk of a subsequent recurrence. A vaccine in that setting would hopefully engage the immune system and have the immune system keep the cancer from recurring. So these trials are ongoing. They're going to take years really to see if it truly is effective, but there's a lot of hope and effort towards that.
Great. Very exciting. Well, thank you so much for joining us.
My pleasure.
If you'd like to learn more about St. Luke's breast cancer treatment options, please visit stlukeskc.org/breastcancer. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.